Now we are going to see about vitamins. Vitamins are any several organic substances that are necessary in small quantities for normal health and growth in higher form of animal life. And vitamins are classified into fat-soluble vitamins and water-soluble vitamins. Fat-soluble vitamins are subclassified into vitamin A, vitamin D, vitamin E, and vitamin K. And water-soluble vitamins are subclassified into vitamins B and vitamin C. Now we are going to see about the fat-soluble vitamin, vitamin E. Vitamin E is also called as tocopherol, and it is a naturally occurring antioxidant. And it is essential for normal reproduction in animals, and hence it is also known as anti-sterility vitamin. Coming to the chemistry of vitamin E, vitamin E is the name given to a group of tocopherols and tocotrienols. About 8 tocopherols have been identified: alpha, beta, gamma, delta, sigma, etc. Among this, alpha tocopherol is the most active. The tocopherols are the derivatives of 6-hydroxychromane ring with isoprenoid side chain units. The antioxidant property is due to the chromane ring. They differ from each other in the number and position of methyl groups on the chromane ring. Chromane ring is nothing but the first ring of tocal nucleus. This is the picture showing the structure of alpha tocopherol, beta tocopherol, and gamma tocopherol. The methyl group varies. In the case of alpha tocopherol, the methyl group is present in 5th, 7th, and 8th position, and hence it is called as 5,7,8 trimethyl tocal. And in the case of beta tocopherol, the methyl group is present in 5th and 8th position of the tocal nucleus, and it is called as 5,8 dimethyl tocal. And in the case of alpha gamma tocopherol, the methyl group is present in 7 and 8, and hence it is called as 7,8 dimethyl tocal. Now we are going to see about tocotrienols. Tocotrienols are less potent compounds and have an unsaturated side chain. The characteristics of vitamin E is heat stable, and it is oxidation labile, and it is alkali labile, acid stable. And vitamin E is lipophilic in character and found in association with lipoproteins, fat deposits, and cellular membranes. Coming to the sources of vitamin E is present in all types of oils. Example, cottonseed oil, corn oil, rice bran oil, sunflower oil, wheat germ oil. Apart from this, it is also present in milk, egg, dry soybeans, cabbage, yeast, lettuce, and alfalfa. This is the picture showing the sources of vitamin E. Now we are going to see about the daily requirement, that is also called as recommended dietary allowances. In the case of children, it is 6 milligrams per day, and in the case of female, it is 8 milligrams per day, and in the case of male, the daily requirement is 10 milligrams per day. Coming to the absorption of vitamin E, it is readily absorbed from small intestine with the help of bile, and it transported to liver by chylomicrons and its remnants. The liver, it gets incorporated with very low density lipoprotein, and it is transported in the blood. It is stored in adipose tissue and liver. Coming to the functions of vitamin E. Oxidative damage occurs when highly unstable molecules known as free radicals form normally during the cell metabolism and disrupt the cellular structures. Antioxidant property is the important property of vitamin E. Vitamin E is involved in trapping of free radicals. Free radicals cause damage to cell membranes by peroxidation of unsaturated fatty acids of cell membranes. Vitamin E inhibits this peroxidation and prevents the damage to cell membranes. Vitamin E prevents the peroxidation effect of hydrogen peroxide and nitrogen dioxide. Vitamin E has specific action on selenium. Vitamin E, selenium, and glutathione peroxidase form the first line of defense mechanism against peroxide formation. Selenium find to decrease requirement of vitamin E and vice versa. Both act synergistically to minimize lipid peroxidation. Vitamin E is essential for the membrane structure and integrity of the cell, and hence it is also regarded as membrane antioxidant. Vitamin E helps in maintaining seminiferous epithelium. Deficiency causes impairment of spermatogenesis and motility of the sperm is affected. It protects RBC from hemolysis by oxidizing agent. It increases the synthesis of heme by enhancing the activity of enzymes like ALA synthase and ALA dehydratase. Tocopherol lactone is involved in the synthesis of coenzyme Q, and it enhances the immune response, and it regulates the platelet aggregation, and it also regulates protein kinase C activation. Vitamin E is needed for optimal absorption of amino acid from the intestine, and it is involved in proper synthesis of nucleic acid. Vitamin E protects liver from being damaged by toxic compounds such as carbon tetrachloride. Next, we are going to see about deficiency of vitamin E. Deficiency are almost never seen in humans. The three important deficiencies are muscle dystrophy, hemolytic anemia, and sterility. A classic vitamin E deficiency occurs in premature babies born before the transfer of the vitamin from mother to the infant, which takes place in the last weeks of pregnancy. Infants are basalized and infant becomes anemic. Heart disease and cancer may arise in part through tissue oxidation and inflammation. People with low blood vitamin E concentrations die more often from these and other causes than do people with higher blood levels. It works in association with vitamin A, vitamin C, and beta carotene to delay the onset of cataract. Vitamin E has been recommended for the prevention of chronic diseases such as cancer and heart diseases. This is the picture showing the deficiency of vitamin E. The first picture shows limb girdle dystrophy, and the second facioscapulohumeral dystrophy, and the third one is myotonic dystrophy. Thank you.